necessary precautions to safeguard our health and the health of our loved ones. Join our host Dorothy Babazi with our guest Dr. Nachigozi Harriet live on Bethany TV this Saturday at 8 p.m.
Love, the foundation of every fairy tale romance. In a world filled with passion and excitement, it's easy to believe that love alone can conquer all. But the truth is, marriage is a journey that goes beyond butterflies in the stomach. It is just the beginning. It is also safe to say that a successful marriage requires much more to flourish. On the Chord this Monday with your hosts, Keith, Chula, and Livingstone. Bethany TV for Health.
Good evening, our beautiful viewers. Thank you so much for tuning in at Bethany TV. Tonight, we have quite a good topic that we're going to be sharing. Now, those that are joining us, you can easily catch us on our YouTube channel. You can also catch us on Afro Mobile, Yo TV, and Airtel TV. On health and wellness tonight, I have a very wonderful guest who is going to be giving us an in-depth discussion in regards to different infections that we tend to face, in particular hepatitis B. But before we dive in, I'll just give an opportunity to just say hello to our dear viewers. Thank you so much, Doctor, for joining us tonight.
You're most welcome.
Yes, to our dear viewers.
Dear viewers, it's nice to meet you. I'm Dr. Harriet Nachigozi, and I'm here to discuss insights on hepatitis B. I'm happy to meet you.
Amazing. Thank you so much for availing the time to come in, and then we share in depth about hepatitis B, because I believe this is one disease that tends to impact a lot on different people, and they take long to go in for an diagnosis.
True.
Just in brief, maybe you can tell us, what is hepatitis for a start?
Dear viewers, thank you so much for that. Hepatitis is the inflammation of the liver, and is caused by several viruses, as we are going to see, that we have 5 types of viruses. That is hepatitis A, hepatitis B, hepatitis C, hepatitis D, and hepatitis E. But of all these, you mostly hear about B and C because they are the most types which are of clinical importance. Like they are affecting us seriously, unlike the others, because the others can clear. We call them transient. They can clear within the body when someone has not noticed them. Yeah.
Okay. So you've said B and C are the ones that mostly we need to query more about. So maybe you can give us an insight of hepatitis B in particular.
So just as we've said that hepatitis B is that hepatitis, or it's that infection which is caused by a virus known as hepatitis B virus. And it is mainly common amongst the African population, even the other countries, but here at least Africa is carrying a burden of 25% when you look at the global scale. Though worldwide we have 2 billion people living with this problem. And the most uncommon thing, or the most unfortunate bit of it, that most of us, we don't know whether we are having it or not.
So meaning someone can have it and they don't even know that they have it.
True, because the symptoms take time to manifest. So in our settings like Uganda, we have a prevalence of like 4.3%, which goes on even varying from one region to another. When we look at these regions, we have the central, we have the western, the northern, and others like that. But what we can know that hepatitis B is the most serious one amongst all that.
Wow. Now, most people tend to complain of pains, if I should start with that, and they how does one now decide if I have different pains, body aches and all that? How do I decide that I should even be going for such kind of a checkup as hepatitis B in particular? What stands out? What could be those key symptoms that
Okay, thank you so much. This disease is a bit funny, as I can say, that someone can live it up to like six months when you are not knowing it, because it has two phases mainly, the acute phase and then the chronic phase. So the acute phase is that one which is like from 1 week to 6 months. The symptoms are mild and you can easily ignore them. And the other chronic one is where it is long-standing within an individual. The complications are there and the symptoms are there, but the most outstanding ones, there is that vomiting where I say that you have some, okay, there is that vomit which is caused by the normal fever, but here it becomes outstanding and like it seems I might be having a problem. There is that constant fever, there is that malaise, there is that jaundice, which is the yellowing of the skin and the eyes. Okay. Then there is that abnormal pain, which is still not like the other. Then we can look at the darkness of the urine. This urine sometimes ranges from the color yellow, clear, and that. But for hepatitis cases, you find that they have a dark urine due to the chemical or the component called bilirubin, which is present within that in larger quantities. Okay. Yeah. Wow. And fatigue also is there.
Oh, if someone is constantly feeling fatigued, they could be having.
It's good.
Now I have a friend who usually used to complain a lot about stomach ache, and every time they go for diagnosis, they don't find anything in particular. Now, would such a person worry?
We cannot tie it to one symptom. That's the unfortunate bit of it. But the good news is that this one is preventable through vaccination. Okay. That when we have our children, because we are seeing that on the global scale, 6 million children are living or are surviving with hepatitis B. So the good news, or what we can do to prevent, because prevent is better than cure, that you can be able to go and test yourself, and if you are negative, you can be advised to take a vaccine.
Would you recommend this to be one of the key tests? For example, if I'm looking for a life partner.
True.
Would it be something that I would
It's very true. It's very important for you when you're looking at a partner that first test for this hepatitis B. Why? It is also transmitted through sexual intercourse. So you might waste all your life when you have gone into a person who is already exposed to this virus. So when you're looking for a partner, I advise you that please, this is one of the tests you should not ignore. Plus these others like SCOSA and other tests like HIV.
Amazing, amazing. I realized actually when we talk about infections, most of the time people assume infections, viral, you would be looking at things like cough, flu or something, or just normal fevers and then they wave off. But what I would like for you to throw more light on, what are those risk factors that come with hepatitis B?
With hepatitis B? Hepatitis B, like as we said, it is a virus and it is mainly its mode of transmission, that you can come into contact with it unknowingly, like you can put your body here because it can be left like on an open surface like this for 72 hours. Wow. So if you are not vaccinated, you can easily get it.
So if someone sweats and touches somewhere, they're prone to leave it.
It can be there for 72 hours, at least it's a known virus like that. Okay. Then secondly, through pregnancy, because when you are pregnant, that is why we are telling them that they have to visit the antenatal clinics, because those are some of the things we tell them, that you protect the unborn baby from having it, because there is what we call vertical transmission. When the body is born, when already is having that. So we have that tendency through pregnancy and by birth, that someone can easily acquire it from that. So the risk areas or the risk ways of getting it is through having contact with an infected person or where the virus was left by an infected person. Another one, which is mainly is there, sexual contact, having sex with a person who is already having it, and through birth, pregnancy, or also sharing the needles, the sharps, and those equipment which are easily used by people. Yeah.
Now I'm looking at a situation where someone has it and it's dormant. would such a person be able to transfer it to another person? Or if they're just, that would be like a carrier. Would they transfer it to the next person, or it would stay dormant in their bodies?
Unfortunately, we use that term, but a person who is on treatment, okay, we can say cannot spread, but it is always better that to protect yourself as another person or partner whom he has married and you are not knowing about it, that you can easily be able to protect through vaccination or by having safe sex using condoms like that.
Would a pregnant mother also get vaccinated? For example, if I find out that I'm hepatitis B positive and I'm expecting, what would be the measures that I would take to not transfer it to my child?
So the measures, we normally have those treatments which are normally recommended, and the clinicians can always advise on which one to take. Yeah, for the pregnant, because we know we cannot give a vaccine to the pregnant person, but we have some treatments which are recommended for them.
Okay.
Yeah.
Amazing, amazing. I would also love to, you'd said in Uganda we find so many children having
not Uganda alone, because
like
the 6 million is
worldwide.
But
Children.
in Uganda still we have those cases.
I'm looking at the environment that children are in. That means they're very, very interactive. At what age should you now start taking measures to make sure that your child does not get infected? Can they get vaccinated as early as being born, or?
So actually, we thank the government of Uganda. It has incorporated it into the normal routine vaccines we have. Okay. That every child who is born in a hospital, that's one of the vaccines which is administered before you get out of the hospital, hepatitis B. Then with hepatitis A, because it is dealing with ingestion of contaminated food and water. So that one, we are lucky that at least some bodies can fight it. It's not so common like this hepatitis B. Yeah.
Amazing, amazing. So that means once I have my child, the first thing I have to do is make sure they're vaccinated.
Yes, because now
if I expose them to my dear aunties and uncles and all well-wishers of my success of giving birth.
So actually, before you leave the hospital, try to make sure that this child is vaccinated from hepatitis B. And most of these hospitals do administer those doses. Yeah.
Now, I have a mother one time who got a child, and the child got a little bit of an infection prior to the vaccination. And then by the time they were done with the medication, they were told they cannot vaccinate at that particular time. What could have changed? Because I'm looking at this child is still, now is okay, we can now vaccinate. Or the dose that is given has a time limit. Now we have to go for the 3 doses of adults.
It depends on the age, which age or number of days that child have.
Okay.
And secondly, did they test? Because like when there is an exposure, before they administer the vaccine, they must test to see exactly, is he already exposed to this virus? Because when you're already exposed, like the way COVID was, we cannot vaccinate you.
Would someone vaccinate a premature? Now that the child has gone through premature level and then now they're going home, can they vaccinate? Or that would be
testing.
They have to first run tests.
Yeah, because like if that, I'm not quoting your statement that she was told that she can no longer take the vaccine. Probably it would have been the case.
Because they had said that there is a hepatitis for PED, where you give 1 dose.
Yeah.
And then now the period when it was supposed to be given within the first 3 days had passed.
Yes.
Then they had to wait. Now
they had to wait for some good time.
Okay. To our dear viewers, tonight we're discussing about, we're digging deeper to understand hepatitis B. Is this an infection that we should worry about? Is it something that we should take for granted? But then this is an infection that we shouldn't really take for granted, according to our wonderful doctor here. Now, we're going to go in for a very short break, and when we come back, we'll discuss further on how best we can draw remedies that can help us to avoid hepatitis B.
Bethany TV for health. Love, the foundation of every fairy tale romance. In a world filled with passion and excitement, it's easy to believe that love alone can conquer all. But the truth is, marriage is a journey that goes beyond butterflies in the stomach. It is just the beginning. It is also safe to say that a successful marriage requires much more to flourish. On the Chord this Monday with your hosts, Keith, Shula, and Livingstone.
Child health and well-being, the foundation for a bright and promising future. Join us for exciting episodes aimed at optimizing our children's physical, mental, and emotional health with our team of experts, including pediatricians, nutritionists, and child psychologists, every Wednesday at 8 p.m. on Bethany TV.
Bethany TV for health. Are you ready for this good news? You can now watch Bethany TV on Your TV, AfroMobile, and Airtel TV apps. Yes! Catch the finest programming prescription for everybody, wherever you are, whenever you are. Bethany TV for health. Bethany TV for health.
Thank you so much for staying with us at Bethany TV. We are discussing about hepatitis B. Now, if you're just joining in, when you go to our YouTube channel, you can be able to go back and see what exactly have we discussed further in terms of hepatitis B. Now, I'll just go straight to Doctor. You're telling us about hepatitis B. Now, one thing that stands out for me, I've heard about chronic hepatitis B.
Yeah.
And then there is acute hepatitis B.
True.
Now, what is the difference about these two?
Thank you so much. These are stages or phases of hepatitis B. We have the acute, whereby you are infected from that disease, hepatitis B. And this one, we said it can take a week to 6 months. You're feeling those mild symptoms, but you are not yet sure that whether you have that disease or not. Yes, you can have the malaise, you can have the fever, the vomit, but it's not so serious in its way of the way it is affecting the liver. Because in all this, we are looking at how it is affecting the liver. You know, the liver is a vital component that it does a lot of processes, like it processes the nutrients we eat, that the body can get what is required to function properly. Then also it is helping us to filter the blood and also to do other processes like detoxification. So when we are looking at the mild case, it has entered, but the liver is not yet too much swollen, because inflammation is all about swelling of the liver, and this happens within the liver tissues. So in this case, we can manage it, and maybe a person can manage it. Then when you look at the chronic phase, this is whereby a person has lived with hepatitis. Some can have spent with the last 1 year, the last 2 years, the 3 years, but this one has to be managed. That's why we say that when we diagnose you, we don't leave you like that. You have to be linked to treatment immediately so that you can take longer. Because each time this liver is affected, it also affects your body, that it leads to some serious consequences which lead to death.
Wow.
Yeah. So that is what we say, that chronic hepatitis normally leads to death. And we are always giving this talk to make sure that we prevent so many deaths from this problem, which can be curable. In case you have known it early, you have diagnosed yourself, or you have never tested, you can easily take up an hepatitis test to save your life.
Okay. I've had, I don't know if I should call it a myth, but I've heard that once you have hepatitis B, you have it for life. there is no turning back. You're going to be on medication all through. You have it for life. How true is this?
Okay, we have those myths, but what I can say that when you find yourself positive, it's not the end of life.
Okay.
So many people are living a positive life, like HIV. Before we came into this mass campaigns of please test HIV, people are living in fear.
Yes.
But once they knew and they are knowing that people can spend like 30 years. So even hepatitis is like that. So what you just have to do is take precautions. How do you help yourself to survive? Don't overwork your liver. What do I mean? That overworking the liver is exposing it to these things which are making the cells to become more prone to cell death, or what we call cirrhosis, which leads to what we call liver cancer or hepatocellular carcinoma. So when you know that I'm positive, you can limit on the fatty foods you eat, because that is one of the things that when you're exposed to too much fats, this one is going to overwork the liver.
So the diet has to be in place.
Has to be improved. Then secondly, you can stop alcohol, because some of these alcoholic drinks are also leading to the problem. They're worsening the problem.
True.
When the liver is overworked, remember these cells are already deflamed, or they're already swollen. They cannot perform like a normal liver. So if you reduce on that, you can prolong on your life. Then another thing, you can avoid taking drugs which are not prescribed, because we see that some drugs, when you take overdoses, they can easily lead to this problem.
True.
And also avoiding smoking, plus multiple sexual partners.
Just not to add yourself the other virus. Oh, okay. Are there any other preventative measures that someone can be able to take to make sure that they are, in case they find themselves positive?
Okay.
Yes.
In case you find yourself positive, try to take more precautions on your dieting, because we've seen that dieting working. Adhere to your treatment as prescribed by that doctor, because normally we link them to hepatitis clinics, and in different regional referral hospitals or general hospitals, we have those established clinics and those doctors who can be able to manage them properly. Yeah.
Now, I've seen certain people when they find themselves in situations that require, should I call them detoxifying the body, they tend to divert into natural remedies. They go for natural herbals and all that. Do they work actually? Have you seen actually someone come and they said, "Me, I've been on my herbal. I'm no longer having hepatitis B."
I cannot refute the fact like that, because when you look at our forefathers, they used to survive. But these days, it's a bit hard. Tell me why. Because we're exposed to so many things.
True.
And someone will come and tell you this one heals a number of diseases. When you check that, it doesn't have any active ingredient in that. And sometimes these herbals also lead to what we call the overworking of the liver. So unless something is proven to be safe, I cannot recommend much on that. But with foods, food is medicine. You can eat your food, natural grains, eat your vegetables, eat katunkuma. Those ones, at least we know that at least they can reduce on their burden, though they don't treat.
Are there any particular available treatments that this is, if I am hepatitis B positive, this is the treatment that I should be on?
They are normally given in combinations, just like HIV drugs, the anti-HIV, even you have the anti-hepatitis drugs.
Okay.
Yeah, so it is normally those doctors who are trained to prescribe, that they can be able to tell you that use this. When you are reacting to this, we can change to this.
Now I'm looking at,
because when we mention them here, people have a tendency of going over the counters. And I heard the doctor telling us this. That's why we say we have to reserve them for special treatment.
Yes.
Yeah. Otherwise, someone, when you mention like this, tomorrow they'll go over the counter and mention that I need this, which we are not
And yet they're not even so certain if they have the disease because they have to first test.
You need to
they
first
might base
test.
on the
Yeah, the only thing, the test is simple, it's not painful. You can test and then it can relieve you from a lot of stress and burden.
Now maybe just to throw a little bit more light, are these treatments available even in our local communities? I'm looking at my mother who is deep in Bufundi. Can she actually access these medications in our hospitals?
Up to the lowest health center 2s and 3s, because those are the lowest units in Uganda.
True.
So they are available up to the national referral hospitals, because they are just rapid tests. Yeah.
Okay. Okay. So what I would love to know how best as an individual, what kind of measures can I put in place to make sure that I am not, I want to say exposed, but then I'm looking at how best can I preserve myself to be able not to catch hepatitis B.
To be able not to catch hepatitis B, avoid sharing, because we've seen this avoiding sharing needles, syringes, especially to the health workers. One of the precautions we give to the health workers is vaccination. Even me, I had to vaccinate as early as 2010 when I began working from Uganda Virus Research Institute. It was a policy. Before you get into their laboratories, you had to vaccinate. So every health work, because we're exposed to blood.
True.
You're exposed to some of these surfaces. So how can they protect you, especially your employee? The only thing is to make sure that you're vaccinated, and it's normally at 2 doses. One is given, and then you come back like a year, they give you. And then you are able to know that at least I'm safe.
Now, just to throw some bit of more light, is vaccination of hepatitis B similar to tetanus? I've had to take so many different shots. Every time I go to them, you're supposed to come 3 months ago. Now it's
not like that.
Can I forget and then I remember, oh, 1 whole year has passed now, I've passed another 6 months. Can I still go for the other shot and it would still be viable, or I would still have to start afresh?
This one, it is proven beyond doubt that the 2 are lifelong doses. Yeah, not like that 3 months. When you're pregnant, still they give you that tetanus.
Yes.
Yeah, this one
so even if I took some time before going back for the next shot, it would still be viable. You have
to take in the prescribed time, because today I've been talking to someone, it's like, I took my hepatitis dose and it was last year, but 1, yeah. So I didn't go back for my 2nd dose. Is it now still active? So if you have not taken it in a prescribed time, forget. It's like you are half protected.
So I would need to again start afresh.
Yeah, you have to restart.
Wow, amazing, amazing.
Then secondly, you need to avoid to get in touch with these contaminated surfaces. Yeah, you as an individual also take action or take preventive measures.
If I sanitize after touching the places I'm safe, you know, nowadays the remedy
remain on inanimate objects like
yes,
this for 72 hours. Those are 3 days.
Yes,
this is 24 hours. So at least be keen. You can disinfect, you can sanitize to make yourself safe. Then where I say special, I usually tell people that about the beddings, where we visit some places and people have been there, they've been having the sexual intercourse. Remember, semen, body fluids are all there. True. It can easily be a route for you to get these. So prevention is better than cure.
Is there anything else that someone should take home and be like, okay, now this I have to definitely avoid?
That I have to definitely avoid. Avoid sharing sharps. Yeah. Laser blades, nail cutters, especially the ladies. Assist me, then you don't know the history of the person you are asking. So that is one of the way which has always caused those problems. Make sure you vaccinate. That is the safest way. There is no any other way apart from getting the vaccine. Then other way is you have to be mindful. In case you have a partner who is infected, insist on using condoms during sex. That's the only way you can.
Until they're done with that treatment.
Yeah, and make sure that they adhere to their treatment. Yeah.
Now, I'm looking at how can we support people who are living with hepatitis B,
yes,
as bystanders. How best can we be there for them?
How best can we be there for them? try to give them knowledge about them, true knowledge, not myth, about hepatitis, because they will already have that fear. So it is you people to counsel, to give them the good knowledge, what they are supposed to know. Provide or link them to treatment, because treatments are there. So in case you have a relative who is in the village, make sure that that person is able to attend a clinic and be able to be there, call to know that this person is attending, and talk to the doctor who is attending to that person.
Okay.
And people who have not screened, we always tell them that we screen. That is the only way we can know. And when we screen, we are linked to treatment.
What period would you give the screening? Can I go every week, every month? What would be the most appropriate period of screening?
Period of the screening, when you screen, at least by now, when you screen today and they tell you you don't have, so you just take precautions that you don't get in touch with this. Otherwise, I cannot advise you go and screen every day. No, because your immune at least has been built by your body to fight off some of this. It is believed that most of us have been exposed to this, but our immunity also matters.
Are there any diseases that become like a pipeline for this disease to come in, or because these are actually things that people find themselves perturbed about, especially if they have a certain disease, they think now also hepatitis might come into the play. Are there any particular diseases that can be a pipeline to getting hepatitis B?
As I've said, it is a viral infection, so it is a standalone, but at times it comes in, especially with people who have HIV, because their immunity has been lowered. So they tend to have this. They're at a greater risk or chance of getting this. Then even others, we cannot guarantee that there cannot be other factors. But what we can say, let us be vigilant about ourselves. Even other diseases, let us try to check early. Because we've said that it is about inflammation of the liver. You never know, because there is what we call immune cells. There are sometimes cells fighting against their own cells. And that one can also lead to liver problems. And that is where hepatitis is. Yeah.
So meaning I have to just make sure that my liver is in good shape.
Yes.
Because
and
if
the
it's
eating
not...
behaviors. Yeah.
Okay. Are there any particular foods that would be boosters? Apart from our greens, our katunkuma, are there any particular foods? Now, there are certain people will be like, I shouldn't miss my matoke, it's a booster. Are there any particulars?
Well, we can say fruits. Fruits are good, and vegetables, because they alleviate a number of diseases. That's what I can say, plus any other things. Just as I said, also to avoid the fatted meals, fats, meat, milk. We have to regulate, actually, to eat a balanced diet. So don't be like, me, I'm selected, I'm going to be eating this alone.
I was about to put my cup of milk aside and be like, okay, now.
But
it's fatty.
It once in a while.
Okay.
Yeah.
I just have to be mindful of the quantity that I'm taking.
And how often do you take it?
Amazing. I would love to hear more, just a little bit more on what kind of mechanisms have been put out there to support and also to remind people of how serious this illness is. Now, I believe there are certain measures. What exactly is happening in the medical world that you're setting aside to educate and mentor people about hepatitis B?
Wow, that's good. We have non-government organizations. These are doing well in the fight against this. They go out and do advocacy. We have also government programs, because I work with the Ministry of Health, the Department of National Health Laboratory and Diagnostic Services. We have also outreach programs where we are able to go to different communities, create awareness, like the way I've come for the talk show. You try to give information to the public. And if people get it, because even the Bible tells us that my people are suffering due to lack of
knowledge.
Yeah. So if people are there to eat, that is a plus, because these awareness have been proved to make major changes, because prevention is better than cure. Still, treatments are available in because we say we have specialized clinics. These clinics are not like the general clinics. So we limit them to the specialized clinics because we must have consultants, people who are trained to handle that. Like we have hepatocellular clinicians who are specifically concerned with liver and they are treating that, just like we have the pediatrics, specifically for the children. So that is how we are able to help the generation. And still on July 28th, the world celebrates what we call the World Hepatitis Day. This one brings together people in the fight against hepatitis B. Whether you are studied or not, whether you are a teacher, whether you are a clinician, whether you are a nurse, whether you are a person on the radio, whether you are a policy maker, these ones come together to address this.
Wow. Amazing. To our dear viewers, we are discussing about hepatitis B. Now, if you're within the metropolitan area, you can also reach Bethany Hospital. It is one of the places where you can run easily the test and get diagnosed and also get the necessary help. I love the initiative that has been put in place specifically to be able to mentor and also inform people of the different ways they can be able to fight against this particular virus. Now, to our dear viewers, what is your take-home message for them? I believe there is quite a lot that you would want them not to miss out when it comes to hepatitis B, because this is one of the diseases that is very serious if not if taken for granted, and can actually cost someone a life.
True.
Yes.
So what I can tell them that hepatitis B kills 3,000 people annually or per year. That's very important, including Uganda, including the United States of America, including everywhere. Hepatitis B is a problem. Then secondly, hepatitis B, if left untreated, can lead to what we call liver cancer. Who wants to die of liver cancer? We've had so many cases, but we didn't know how they came about. So one of them is when you live untreated. This is where we are going. Then 6 million people, especially 6 million children, are living with hepatitis B.
And this is the next generation.
How did they get them? How did they get to this level? It means it is us, the mothers, who have to play a critical role. Another thing we say hepatitis B is preventable through vaccination. So we've seen so many diseases, measles, diphtheria, tetanus, which are the 6 killer diseases.
Yeah, whooping cough.
We've been able to eliminate them through vaccination.
True.
The good news about hepatitis B, even C, is vaccine preventable.
Wow.
Yeah.
Thank you so much, Doctor. In case you're just joining us, we're talking about hepatitis B, one of these virus infections that are currently challenging us in our health. Now, if you've not been able to catch us, feel free to go to our YouTube channel, subscribe, and you can be able to access this whole discussion. And in case you don't have the time to go there, we are going to still do a repeat tomorrow, and you'll be able to have a discussion. If you have a question, go to our social platforms, that is Facebook, YouTube, Twitter, and Instagram, and just post that comment there, that question, and we'll be able to have those questions answered. Doctor, are there any last remarks that you would love to share with our public?
Thank you, dear viewers. As we are talking about hepatitis B, it is a serious illness that has caused a lot of death, or what we call mortality, across the whole world, especially to our Africa, where we are still struggling with a number of diseases. We still have the TB, the malaria, and now when you add on this, you add on COVID. This is also what is having us. But the good news, we say that together or united, we can still fight and have a healthy population.
Wonderful. Thank you so much, Doctor. It was an honor to have you in our studios tonight.
Thank you.
To our dear viewers, Thank you so much for staying on Bethany TV Health and Wellness. It's always available every Saturday from 8 to 9 p.m. Now, today I'm sitting in for Dorothy, but she'll be available come next Saturday, where we'll be digging further on how best can we stay healthy and live a fulfilled life. Thank you so much. It has been a beautiful evening. Good night.
Love, the foundation of every fairy tale romance. In a world filled with passion and excitement, it's easy to believe that love alone can conquer all. But the truth is, marriage is a journey that goes beyond butterflies in the stomach. It is just the beginning. It is also safe to say that a successful marriage requires much more to flourish. On The Chord this Monday with your hosts, Keith, Chula, and Livingstone.